The chief of the World Health Organization says he's very concerned about the increase in cases of COVID-19 in China. It's been 2 weeks since the most severe restrictions were lifted and cases are reported to be rising fast. Ross Atkins has more.
China's zero COVID policy is over and the virus is surging. China's chief epidemiologist is warning this is the first of 3 waves. One doctor quoted by state media calls this a pandemic tsunami. And establishing how big this outbreak isn't easy. Official statistics note 16 COVID deaths in the last month, but there's scepticism about these figures. Then, look at the far right of this chart. The number of confirmed cases is falling, but that's because mass testing in China stopped recently, which means no one's quite sure what's happening with the virus. There are, though, ways that we can build up a picture of this surge. The BBC's team in Beijing filmed this queue outside a health clinic and filmed this queue outside a pharmacy. The sign says no cold and flu tablets, no thermometers and no testing kits. Social media is another potential source of information. By cross-referencing with other images posted online, the BBC has verified this video, which shows overcrowding at a children's hospital in northern China. We're seeing lots of other videos too, appearing to show hospitals under pressure. But these are difficult to verify.
There are restrictions on Chinese social media platforms that stop people from being able to post freely, and therefore it can be difficult to get an accurate assessment of what's happening on the ground.
Social media is one source, news agencies are another. Reuters reports that in Beijing, the local emergency hotline has been overwhelmed by over 30,000 calls per day. Reuters also filmed these queues of vehicles outside a crematorium, though it's not clear if this is caused by COVID. Or in Guangzhou, a crematorium worker told the AFP news agency it's 3 or 4 times busier than in previous years. As well as news agencies, we can follow official statements too, such as this in Beijing.
Medical supplies in the city and treatment resources are under increasing pressure due to the rapid spread of the epidemic and the continuously rising number of patients with fever.
On state TV, we're seeing a door-to-door vaccination drive targeting elderly people. And as the health service tries to cope, so do the people of China.
My entire family have fallen ill and are trying to get better at home. But everyone is free to go outside now, which I think has made life easier.
People can go outside, but many are choosing not to, either because they have the virus or because they want to avoid it, which is something that China's been trying to do for 3 years. Now, though, COVID is spreading freely, and China's vaccines and its health service are being severely tested.
Ross Atkins with that report.